Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Overall survival with neoadjuvant nivolumab plus chemotherapy in lung cancer. Background. Neoadjuvant nivolumab plus chemotherapy significantly improved pathological complete response and event-free survival in patients with resectable non-small cell lung cancer, NSCLC, in a Phase 3 trial. Data are needed on overall survival. See conclusions. 3 cycles of neoadjuvant nivolumab plus chemotherapy significantly improved overall survival among patients with resectable NSCLC, as compared with chemotherapy alone. Next article. Elinzanetant for vasomotor symptoms from endocrine therapy for breast cancer. Background. Women receiving endocrine therapy for hormone receptor, HR-positive breast cancer or its prevention among those at high risk for breast cancer commonly have vasomotor symptoms. Data are lacking on the effects of elinzanetant, a neurokinin-targeted therapy shown to be effective in treating vasomotor symptoms, in this population. See conclusions. Elinzanetant led to a significantly lower frequency of vasomotor symptoms associated with endocrine therapy than placebo. Next article. Phase 3 trial of inhaled Molgramostim in autoimmune pulmonary alveolar proteinosis. Background. Autoimmune pulmonary alveolar proteinosis, APAP, is a rare disease characterized by progressive surfactant accumulation and hypoxaemia, caused by autoantibodies against granulocyte macrophage colony stimulating factor, GM-CSF, which alveolar macrophages require to clear surfactant. Molgramostim is a formulation of inhaled recombinant human GM-CSF, but its efficacy and safety in patients with APAP have not been studied sufficiently. Once-daily inhaled Molgramostim led to a greater increase in pulmonary gas transfer than placebo in patients with APAP. Next article. Adjuvant Cemiplimab or placebo in high-risk cutaneous squamous-cell carcinoma. Background. Patients who have cutaneous squamous-cell carcinoma with high-risk features are at risk for recurrence after definitive local therapy. The benefit of systemic adjuvant therapy options has not been well established in clinical trials. See inclusions. Adjuvant Cemiplimab therapy led to longer disease-free survival than placebo among patients at high risk for recurrence of cutaneous squamous cell carcinoma. Next, we will be discussing articles from Journal of American Medical Association. Stapokibart for severe uncontrolled chronic rhinosinusitis with nasal polyps. The CROWNS 2 randomized clinical trial question among patients with severe chronic rhinosinusitis with nasal polyps taking a daily intranasal corticosteroid. Does stapokibart, a novel anti-interleukin-4 or alpha monoclonal antibody, decrease nasal polyps and reduce symptoms of nasal congestion? Findings. In this randomized clinical trial that included 179 participants from China, stapokibart significantly reduced polyp size and improved nasal symptoms at 24 weeks in patients with severe chronic rhinosinusitis with nasal polyps, meaning among patients with severe chronic rhinosinusitis with nasal polyps treated with a daily intranasal corticosteroid, stapokibart reduced polyp size and severity of nasal symptoms at 24 weeks. Next, we will be discussing articles from Annals of Internal Medicine. Measurement error and the cost-effectiveness of intensive blood pressure targets. Background. Analyses of clinical trials find that an intensive systolic blood pressure, SBP, target of less than 120 mm Hg, is cost-effective compared with a target of less than 140 mm Hg for patients at high cardiovascular disease risk. However, guidelines from the American College of Cardiology and American Heart Association recommend a target of less than 130 mm Hg, citing blood pressure measurement error in routine practice conclusion. For SPRINT-eligible patients at high cardiovascular risk without diabetes or prior stroke, a target of less than 120 mm Hg seems cost-effective across most settings with SBP measurement error. In scenarios with high error and an increase in CVD risk at low SBPs, a target of less than 130 mm Hg may become cost-effective. Effect of lateral versus supine positioning on hypoxaemia in sedated adults. Objectives: to evaluate the effect of lateral versus supine positioning on incidence of hypoxaemia in sedated patients, and to provide evidence-based recommendations for respiratory strategies. Conclusions: placing sedated adults in the lateral position significantly reduces the incidence and severity of hypoxaemia and decreases the need for airway rescue interventions without compromising safety. Given its simplicity and low cost, lateral positioning could offer advantages in remote or resource-constrained clinical settings. Further replication studies targeting patients with advanced age and high body mass index are needed to improve the generalizability of the findings. Next, we will be discussing articles from Lancet. Spironolactone versus placebo in patients undergoing maintenance dialysis. Achieve, an international, parallel group, randomized controlled trial. Background: patients undergoing maintenance dialysis for kidney failure are at substantial risk of cardiovascular morbidity and mortality. We aimed to establish if spironolactone reduces heart failure and cardiovascular deaths in these patients' interpretation. Among patients receiving maintenance dialysis, spironolactone 25 mg daily orally did not reduce the composite outcome of cardiovascular mortality and hospitalization due to heart failure compared with placebo. This trial did not identify a benefit of initiating spironolactone in patients receiving maintenance dialysis. Future research should consider alternatives to steroidal mineralocorticoid receptor antagonism to reduce cardiovascular morbidity and mortality in patients receiving maintenance hemodialysis. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from JAMA Oncology. Cemiplimab plus axitinib for advanced fumarate hydratase deficient renal cell carcinoma phase 2 non-randomized clinical trial. Question: what are the outcomes of cemiplimab plus axitinib for treatment of patients with advanced fumarate hydratase deficient renal cell carcinoma, FH deficient RCC? Findings: in this non-randomized clinical trial, 41 patients with advanced FH-deficient RCC received at least one cycle of cemiplimab plus axitinib. The objective response rate was 56%, with a median progression-free survival of 19.8 months and a manageable safety profile. Meaning these promising findings suggest that cemiplimab plus axitinib warrants further investigation in patients with FH-deficient RCC. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Safety, efficacy, and pharmacokinetics of daily optimized doses of rifampicin for the treatment of tuberculosis. A systematic review and Bayesian network meta-analysis. Background: higher than standard doses of rifampicin could improve the treatment outcome of drug-susceptible tuberculosis, TB, without compromising the safety of patients' conclusions. Optimal doses of rifampicin may be between 25 and 35 mg/kg/day, but should be tailored at the individual or, at least, at the population level. Here are the articles from Arthritis and Rheumatology. Here are the articles from Journal of Clinical Rheumatology. Non-infectious uveitis in pediatric rheumatology, long-term follow-up at tertiary centers. Objectives: our study aimed to identify potential predictors for additional systemic involvement in patients with non-infectious uveitis, specifically focusing on their demographic, etiological, clinical, and laboratory data features from the pediatric rheumatology perspective. Our study demonstrated that the anti-nuclear antibody positivity and the high erythrocyte sedimentation rate values were identified as significant independent predictors for SDU in patients referred with non-infectious uveitis. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. A nationwide factorial randomized trial of electronic nudges to patients with chronic kidney disease and their general practices for increasing guideline-directed medical therapy. The Nudge CKD trial. Background. Many individuals with chronic kidney disease, CKD, face a considerable but modifiable risk of cardiovascular and renal outcomes because of suboptimal implementation of guideline-directed medical therapy, GDMT. We investigated whether electronic letter-based nudges delivered to individuals with CKD and their general practices could increase GDMT uptake tension inclusions. In this nationwide pragmatic, 2x2 factorial implementation trial, electronic letter-based nudges on GDMT delivered to patients with CKD, or their general practice, did not increase the uptake of a renin-angiotensin system inhibitor or sodium glucose cotransporter 2 inhibitor, as compared with usual care. Here are the articles from Journals of the American College of Cardiology. Paclitaxel-coated balloon for the treatment of multilayer in-stent restenosis, agent IDE subgroup analysis. Background. Patients with coronary in-stent restenosis, ISR, within multiple layers of stent pose a specific clinical challenge because of higher rates of recurrent restenosis, as well as a desire to avoid an additional layer of stent. Drug-coated balloons, DCBs, provide an alternative anti-proliferative therapeutic option for multilayer ISR. Conclusions. Patients with ISR of multiple stent layers had higher rates of adverse stent-related events compared with patients with single-layer ISR. Treatment with a paclitaxel-coated balloon led to greater absolute risk reduction in 1-year TLF among patients with multilayer ISR compared with an uncoated balloon. From JAMA Cardiology. Polygenic prediction of peripheral artery disease and major adverse limb events. Question. How does a polygenic risk score, PRS, perform in estimation of peripheral artery disease, PAD, and major adverse limb events? Findings. In this cohort study of 3 populations, a new PRS was significantly associated with PAD and stratified risk for incident major adverse limb events. Addition of high PRS, top 20%, to guideline recommended screening criteria increased the proportion of identified cases of incident PAD, meaning polygenic background shows potential utility in primary and secondary prevention of PAD. However, further research is needed to optimize performance in non-European populations and determine its associated effect on vascular outcomes. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Association between urinary phthalate metabolites and sarcopenia in U.S. adults from N. Haynes 2011 to 2018. Context. Phthalates, widely used as chemical additives, are often found as mixtures in the environment. However, the combined impact of phthalate exposure on sarcopenia remains unclear. Objective. This study aimed to investigate the relationships between phthalates and sarcopenia in adults. Conclusion. This study provides new evidence that co-exposure to phthalates might increase the risk of sarcopenia. Further research is needed to explore the causal relationship between phthalate metabolites and sarcopenia, as well as to elucidate the underlying mechanisms involved. Here are the articles from Diabetes Care. In utero exposure to maternal hyperglycemia and offspring type 2, diabetes genetic risk score are independently associated with risk of impaired glucose tolerance in youth. Free objective. We tested associations of type 2 diabetes genetic risk score, T2D-GRS, and exposure to maternal hyperglycemia with childhood impaired glucose tolerance, IGT, and T2D and glycemic outcomes in youth from the Hyperglycemia and Adverse Pregnancy Outcome Follow-up Study. High genetic risk for diabetes and in utero exposure to maternal hyperglycemia are additively associated with IGT plus T2D and glycemic outcomes in youth. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Use of disease-modifying therapies in patients with late-onset multiple sclerosis. Background and objectives. The therapeutic strategy in patients with late-onset MS, LOMS, remains poorly defined. In this study, we aimed to evaluate both clinical and MRI outcomes between two cohorts of patients with relapsing remitting LOMS treated or not yet treated. Discussion. This study demonstrates a beneficial effect of disease-modifying therapy, DMT, on disease activity in patients with LOMS, but without significant impact on disability progression. Main limitations are linked to the challenge of data collection and to the baseline imbalances between the two groups. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Normosol R versus lactated ringers in the critically ill. A randomized trial. Background. Balanced crystalloid solutions may improve clinical outcomes compared with saline for some critically ill adults, but it is unclear whether differences in composition between balanced crystalloid solutions affect outcomes. Research question. Does the choice of balanced crystalloid solutions, Normosol R versus lactated ringers, impact acid-base status, organ function, or outcomes for critically ill adults? Interpretation. Among critically ill adults, the use of Normosol R for fluid therapy did not affect plasma HCO3- concentrations or clinical outcomes compared with lactated ringers. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Mechanically affected lung and progression of emphysema. Rationale. Most emphysema is believed to arise from small airway disease, but recent data suggest emphysema begets more emphysema, and that its progression may be due to the mechanical stress experienced by normal lung regions adjacent to existing emphysema. Objectives. To determine whether new emphysema arises from this penumbra of mechanically affected lung, MAL, or from small airway disease. Conclusions. Most new emphysema arises from areas of high MAL and in substantially higher proportion than areas of small airway disease. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Population Health Management Impact on Healthcare Utilization and Costs in CKD. Post-hoc analysis of the Kidney Coordinated Health Management Partnership Trial. A population health management intervention for CKD reduced inpatient hospitalizations by 27%, compared with usual care over a one-year follow-up. Despite lower hospitalizations, total healthcare costs were not significantly different between population health management and usual care. Sex differences in the exertia introduction to enhance performance in dialysis trial. Inactivity in patients with ESKD worsens quality of life, function, and increases morbidity. Post-hoc analysis of the exertia introduction to enhance performance in dialysis trial explores 6-month exercise effects in dialysis patients, stratified by sex. Sex-based findings may inform tailored interventions to enhance function and quality of life in patients with ESKD.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.